Besides, he could get rid of a lot of medication or supplements he gave to that one person.
Mm-hmm.
And so I was interested. I have a printout of some of them.
Okay. Yeah, there's a lot of different peptides, that's for sure.
And I even got some here, but I don't know, can I take it both together or how?
Definitely can, definitely can. I mean, we can take a look at what you're seeing, and we can talk more about that at the end. But yeah, so that's what we're going to be talking about today is peptides, in particular, Quicksilver Scientific. That's who I represent. We recently came out with a whole line of peptide products. We're going to be coming out with more, so we're going to highlight some of those today for you. And just to get to the basics here, so what are peptides? Well, there's a lot of different peptides out there. So they are building blocks of 2 or more amino acids, basically that make up proteins. And these peptides are more or less signaling molecules. So they bind to our receptor sites on our cells, and they basically communicate with our cells. They send signals, hey, we need you to do this, need you to do that. It stimulates our cells to perform action. And much like anything, as we age, due to bad food intake, medications, all these different negative lifestyle factors we commonly hear about, they decrease, our production of peptides throughout time as we age, all these different things. So there are a lot of different peptides. One that was very common that everyone probably has heard of is GLP-1. Have you guys heard of GLP-1? Ozempic, semaglutide, trizepatide. It's the weight loss peptide that many people have been using lately. So that's a peptide. There's also peptides for collagen production. There's peptides for body healing. There's peptides for a lot of different things. But the one that's most common right now is that people would know of is GLP-1, which is used for the weight loss component. And just to talk about things that are similar as well, hormones. We've heard of testosterone, progesterone, estrogen, etc. Hormones are basically signaling molecules as well. So there's a lot of crossover between how peptides and hormones act. So peptides, why they're getting so popular is they express a very therapeutic outcome with what they do. So they're very potent as well because they're signaling to our cells to perform these actions. So as it says here, they play a crucial role as signaling molecules and therefore can be used for a wide array of different therapeutics. Like we mentioned, weight loss, healing, collagen production, many others that are out there. They're used to treat both acute as well as chronic conditions. They're used for anti-aging purposes. There's a lot of reasons that we utilize peptides. But as therapeutic agents, the reason that they're getting very popular is because they exhibit very high biological activity and specificity. And they reduce side effects because they're very low. They're very non-toxic. So the ones we're going to be talking about today, we produce endogenously. So we produce these peptides in our bodies. And again, just as we age, they start to decline, which, if your wound healing peptide is half of what it was in your 20s, when you have a wound that takes a longer period of time to heal, part of that reason why is because of the lack of peptides that you have now versus when you did when you were younger. So one of the main ones we're going to talk about today is BPC 157, which I'm sure you all have heard about. It's a very well-known peptide, and it's talked about quite a bit as of now. And so just to give you a little bit of basics of BPC, do either of you know what BPC stands for? You're kind of cheating here, but I'll give you a gold star if you do.
I already forgot.
Matilda, do you know what BPC stands for? No? So it stands for Body Protection Compound, okay? So body protection compound, the 1,5 and the 1,5,7 is because it is a 15-chain amino acid, which not that that matters, but just to give a little bit of cool context to the situation here. And so BPC, body protection compound, it's really a universal healing peptide. So I'll go through some of the functions that it does here in a second. But in essence, we produce it endogenously. It's in our gastric juice. So if you had to take a guess, why would BPC be in our gastric juice? Well, our GI tract is our GI tract is the harshest environment in our body. So our gut turns over very frequently. And BPC is very involved in healing of our gut lining because obviously our gut is a very acidic environment, has a lot of different toxins, microbes, things in there we don't want to get into circulation. So it's very important that we have a fortified gut barrier. So endogenously, BPC is mostly working on the gut healing component and the gut integrity component. So it was discovered in 1993 from a gastric juice, and that's where the peptide really has blown up from there. So some of the things BPC is used for is for wound healing. This could be skin, this could be muscle, bone, ligaments, tendons, again, universal healing peptide. Very pronounced in the gut health component, like we had mentioned. It's going to help fortify your tight junctions. It's going to help heal your gut barrier. So, and that can be beneficial for gut inflammation, gut dysbiosis, gut permeability, IBS, IBD, Crohn's, all these different things BPC 157 can help with on the gut side. Anti-inflammatory, that's a big one. It has very strong anti-inflammatory effects, which we do have BPC in combination with some other peptides that also have strong anti-inflammatory effect, which I'll get to in a second here. But that's a big one for the pain relief side of things, obviously, as well. Organ protection obviously helps the stomach. Why is that? Because it's healing our gut lining, along with liver, pancreas, heart, brain. You know, we talk a lot in the functional world about the gut-brain axis. And, you know, if your gut barrier isn't intact, things that aren't supposed to leave your gut are seeping out into your bloodstream. So now that's causing damage to your blood vessels. That's going to go to your liver. That's going to cause damage. It can go to your brain as well, your blood-brain barrier. So now you're causing damage to that barrier as well. So that's where having poor gut health and a leaky gut, as we call it, can have detrimental effects systemically for your health, because these compounds that aren't supposed to leave that very harsh environment are now, because your gut is leaky or things are leaking through that barrier that shouldn't. Vascular health, it helps with blood flow. So nitric oxide production, which, you know, anything blood flow wise, nitric oxide, obviously I'm sure you heard of for that. Very involved in nitric oxide production as well. Neuroprotection, endotoxin. So endotoxin, bad bacterial particles that are in our gut that cause inflammation and damage that seep into circulation again when you have poor gut barrier health. And endotoxins, they call it the most potent initiator of our immune system, because these seep out into our blood vessels and then our bodies go, whoa, what is this? And you elicit an immune response at that, which causes more inflammation and damage as well. So endotoxin, definitely things you want to get removed through your GI and stool, not things you want to be seeping into your blood vessels, which again, BPC is very much so involved in the gut healing component, so that's how that's going to affect and help with that. So another peptide that we talk about frequently and that's also been very popular is TB500. So it's a short peptide fragment derived from thymosin beta 4 or TB4. And it's a repair-based peptide produced by the thymus gland. So TB4 is a much larger peptide. So it's a 43-chain amino. And that's where, due to that just being a large peptide, many companies, many people will look to use TB500, which more or less is kind of like a precursor to TB4. But really, TB500, it's an 8 amino acid peptide, so it's smaller, elicits very similar benefits. So when you see TB500, think tissue, T, tissue. So it's really helping with tissue, ligaments, joint health, inflammation, muscle building and recovery, etc. I'll go through more things that it's doing here in a second. But in essence, with that one, it's typically used for tissue injuries, ligament injuries, muscle building, anything that's tissue ligament related. So T, think tissue. So a little bit more about TB500. So again, it's also going to help with vascular health. Again, think tissue healing. It's going to help with wound healing and dermal repair. It's also anti-inflammatory. And again, the big one with TB500 is the musculoskeletal recovery. But TB500, think tissue. So it's going to help with increased muscle growth, increased endurance and strength, relaxed muscle spasm, improve muscle tone, increase the exchange of substance between cells, helps maintain flexibility of connective tissue, and also prevents formation of adhesions and fibrous bands in muscles, tendons, and ligaments. And I should have mentioned right away, I do get excited about this stuff, so if I start talking quick, you just look at me and give me one of these, and I'll slow down a little bit. So, and if you need me to stop at any slides, if you want to take notes, just let me know. You have any questions, we have a small group. Raise it right away. Nothing yet?
Slow down yet.
All right, well, that's good. That's good. I just thought of that right now. I'm like, I tend to talk quick. When I'm in Texas, I have to consciously think about it. Yeah, because I'm like, they hear me talk, and they're like, what did you just say? So another peptide then that we also have in combination with BPC is called KPV. So this one is a tripeptide or a 3-chain amino, and it's a peptide fragment of alpha melanocyte stimulating hormone, or alpha MSH. So not typically used because it causes skin hyperpigmentation, whereas KPV won't do that, but it has very similar effects. So to simplify KPV before we get to the slide that tells you what else it's doing, when you see KPV, I like to think chronic. So tissue, or TB500, I think tissue. KPV, I think chronic. Obviously chronic spelled with a C, but K, it works close enough. So what do I mean by chronic? So I'm talking about patients that are people that have very poor gut health, right? So chronic dysbiosis, chronic permeability, just gut issues in general. Other types of patients that I would think of as chronic, those who have systemic mold, that's an issue. So you have your mold patients. You have your Lyme patients. You have your other detox patients or overgrowth patients. Why is KP500? Why is KPV beneficial for these chronically ill patients? Well, two factors. One thing is KPV is a very strong NF-kappa B modulator. What that actually means is it really dampens down inflammation. So the reason that that's beneficial for these chronic patients is if you're highly inflamed, your body doesn't detox effectively. So it lowers your detox capabilities. It lowers your liver function. So inflammation is going to downregulate your body's ability to remove these things that aren't supposed to be there. So by dampening down inflammation, it allows the body to effectively detox, where you can then start removing these harmful things and get moving in the right direction health-wise. Outside of just the inflammatory piece, KPV also is involved in our barrier healing, in particular the gut barrier. So it's working in conjunction with BPC to help heal our gut barrier, our blood-brain barrier, really any tight junction or barrier that we have in our bodies. And these barriers are very important because it's what allows things that are supposed to be in our cells, in our gut, in certain areas in and out as needed, whereas if those are weak, again, now things are crossing that barrier that are causing inflammation that aren't supposed to be there that can lead to these issues. So very strong gut healing effect with KPV, which again, that's going to help with chronically ill patients because inflammation, endotoxin, it's seeping into your blood vessels, it's causing inflammation, which now is downregulating your body's ability to remove these harmful substances. So KPV, again, anti-inflammatory and immunomodulating properties, so very strong anti-inflammatory benefit, useful for any gastrointestinal conditions, whether it's Crohn's, IBS, colitis, leaky gut, including Lyme-driven, mold-driven, or dysbiosis, parasite-driven issues as well. Also, can be utilized for wound healing, infection, and scarring after surgery. One thing you'll see with these peptides is there's a lot of crossover between them. There's very similar actions that are being signaled by these peptides, but there are certain ones that are better in certain areas, and that's where we can lean on using those when the time is right. If you're just using it for general healing, general anti-inflammatory support, then you can use the standalone of just BPC. But if you're doing it for more specific conditions or patients, that's where we have these combo formulas as well. So another peptide then is copper GHKCU. So most refer to this as copper peptide. So it's another tripeptide. It's another peptide that we produce endogenously. And the reason they call it copper peptide is basically it binds to copper, which completes the peptide. But when you hear copper peptide, think collagen. So copper, collagen. It's really the collagen stimulating peptide. So very well utilized in the cosmeceutical world, which I'll get into later, but topically very well researched for tissue health, whether it's for skin wrinkles, skin density, skin lightening, all those different things very well researched in. So it has very strong cosmetic benefits to it. But outside of that, it's also, again, helping with collagen production systemically. So if you think about, joint health, if you think about collagen systemically, whether it's, you lost a bunch of weight and your face is, a little sucked in, the tissue's thin, the oral version is going to boost collagen production systemically, so that way your tissue is more thick, dense, if you will. So it's also involved in stem cell renewal and DNA repair, so that's where it is very much so utilized in the anti-aging world for healthy aging overall. I'll share a fun statistic later that explains what amount of copper GHK we have circulating in our 20s versus when we're 60. It's quite pronounced. Also involved in inflammation, surprise, surprise, because anything aging related, inflammation is inflammaging. So it also is going to dampen down inflammation. It's got brain and cognitive health protection, cardiovascular health healing and protection. As you can see here, blocks oxidation of LDL. There's also research on it for reducing fibrinogen, or excess fibrinogen as well. helps COPD by blocking damage-inducing genes. And obviously in a second here, I'll get into the liposomal delivery side of copper GHK. So what are some of the barriers to peptide use? I'm sure it's like you're hearing all these great things. Why doesn't everyone use them? You know, why isn't they being prescribed all over the place? A few different reasons for that. So one of the reasons is it's difficult to get it compounded right now. So that's part of it. And then the second thing is barriers to peptide use in general is they're very poorly absorbed through the gut. So if you're taking a capsuled version of these peptides, they're not going to get absorbed systemically. Reason being is we don't have the necessary enzymes to properly break down these peptides and absorb them into circulation. So if you're taking them via capsule like BPC with KPV, etc., you'll get the localized gut healing benefit of that, but you're not going to get any of the systemic action or systemic benefits that they offer. So the issue with peptides is we can't inject them, and capsules don't get absorbed systemically, so how do we use these things, you know? And that's where Quicksilver Scientific comes into play. So Quicksilver Scientific, who are we? We're really a biotech company. We have a patented delivery technology that we utilize for nutritional supplements, peptides, as well as for compounded hormones, peptides, other things as well. And basically, because of our patented delivery system, we're able to get these peptides circulated systemically without needing to inject them, which, by a show of hands, who would rather pump a liquid in their mouth and hold it for 30 seconds versus inject yourself? I know I would. So how does this work? So what we specialize in is liposomal delivery. So by a show of hands here, have you heard of liposomal delivery? Yes? No? That's okay. So what is a liposome? So we got to go way back to biology 105 here. So a liposome, which is shown right here, is a phospholipid bilayer with an aqueous core. So that's how we administer water-soluble nutrients. To the left of that is a emulsion, which is a phospholipid monolayer with a fat-soluble core. So that's where we administer fat-soluble nutrients. So these liposomes are made out of healthy lipids, phosphatidylcholine, and they actually mimic our cellular tissue structure. So if you would see an image of our cellular membranes, it would look identical to what that looks like there. So that's what our membranes look like, and because of that, these carriers then mimic our cellular tissue structure, and they're able to permeate or absorb through mucosal membranes or mucosal tissue in the oral cavity and go straight to the bloodstream. So one important piece with liposomal delivery is the size of the liposome. So if the liposome's too large to absorb through your mucous membranes, you're not going to get the benefit of increasing bioavailability that you're looking for. So what we offer at Quicksilver is nano liposomes, which nano is just a word for a particle that's under 100 nanometers in size. All you need to know, very, very small. So the reason that's important is when you reach nano size, that's where you get instant permeation, instant uptake through the oral tissue or the mucosal tissue. So how you administer our products is you can see here, this is what a bottle of them look like. This is what a bottle looks like as well. So basically you pump the liquid in your mouth, you hold it for 30 to 90 seconds. The reason you have to hold it for 30 to 90 seconds is just to give these liposomes that are carrying the nutrients enough time to come in contact with our mucosal tissue, and they permeate right through and then go to the bloodstream. So really you hold it in your mouth for the 30 to 90 seconds just to give all these little particles enough time to touch your tissue. And so again, they instantly absorb right through, go to the bloodstream. So because of that, we completely bypass the gut, which allows us to get systemic absorption of these peptides in particular. So just to talk a little bit more about the delivery, so we use this again for nutritional supplements, peptides, etc. So in the nutritional supplement world, outside of just peptides, many compounds have very poor absorption through the gut. Because again, our gut is the harshest environment in our body. It's really made to absorb certain things, keep other things out. And you know, capsuled supplements, powdered supplements, they're great, but you don't absorb as much of that supplement as you may think. It's a small percentage if you have a healthy GI tract. Now if you have an unhealthy gut, you're absorbing even less of that compound. So that's where the benefit of our delivery comes in, is since we're bypassing the GI tract, you're getting adequate absorption regardless if you have the healthiest gut on the planet or the unhealthiest gut on the planet. Which, if we're all going to spend money on supplements, which we all obviously do, that's why we're here today, Would you rather have a supplement that you're peeing and pooping most of it out, or that you know is being absorbed? And that's really at the end of the day what it comes down to. So because of the delivery, we increase the bioavailability or the absorption of these compounds anywhere from 5 to 25 times greater than that of a capsule or powdered form. These ingredients all have different absorption rates through the GI tract, so certain compounds we get absorbed much more effectively than others, just because things like turmeric or curcumin, we've probably all heard of that, right? That's one that's very poorly absorbed through the gut. So that's one that with our delivery, we can actually get a 300-fold increase in the relative bioavailability of. So what does that allow for? You're using turmeric for pain and inflammation. You're taking a powdered capsule form. You might have to take it for a week or two before you notice any relief in pain. With our delivery tech, since it peaks in the blood so quickly and so much more bioavailable or absorbable than these powdered forms, you can get acute pain relief with our natural anti-inflammatory supplements, much like you would out of an ibuprofen, Advil, Tylenol. So you can get these fast-acting effects, which I didn't mention is a benefit of our delivery. As you can see here, is we get peak levels in the blood in 20 minutes with this delivery system. Because you think about when you swallow a capsule, it's got to get into your GI, it's got to get broken down, absorbed, metabolized, then into the bloodstream. That all takes time. So with our delivery, it just permeates through, goes straight to the bloodstream. So we're getting peak levels in 20 minutes. So when you take our products, you're feeling them right away, which we're Americans. We like things quick, right? So benefit of that is if you're looking for something for anxiety or sleep, would you rather have a sleep product that you take right before bed and it's peaking in 20 minutes, or one that you have to take 2 hours before bed? Probably the one right before. If you're anxious, would you rather have the calming effect within 20 minutes, or would you rather have to wait a few hours? You'd probably rather have it very quickly. So that's really where our delivery comes into play. Fast acting, highly absorbable for all these supplements, but it also allows us to get peptides absorbed systemically. So just a few different absorption trials here just to show you the quality of the delivery, because some dude in a suit talking about it doesn't mean as much as a study does. So first one's looking at quercetin here. Are you familiar with quercetin? So it's frequently used for seasonal allergies would be the most common use of it. And quercetin is a compound that has very poor absorption through the gut. So many of these products out there, they'll have you take a loading dose of it because you need to get enough in the bloodstream to elicit benefit. So you might have to wait a week plus before you get relief. With our delivery, we get a 25-fold increase in the bioavailability of quercetin, or the absorption of quercetin. The only thing you'll notice, peaks in the blood in 20 minutes. So what that allows for with our allergy product, Histaid, you take a serving of it, within minutes you're going to get the relief from your allergies, because 20 minutes is when it peaks in the blood. Most people are feeling it as it's climbing to its peak. NMN, or a precursor to NAD. Have we heard of NAD? No. Well, it is a major electron donor in our energy-making processes. So it's very involved in ATP production or energy. It's known as the anti-aging molecule because it's something that declines from the age of 26 on. And so really, energy, anti-aging, there's a lot of cellular health, a lot of different things. That compound we get absorbed 4.25 times more effectively than a powdered form. But the really cool one here is looking at glutathione. Are you familiar with glutathione? Yeah? So our bodies produce glutathione. It is our body's master detoxifier and master antioxidant. So it's really involved in removing these bad things from our bodies and reducing inflammation or removing free radicals, which is what's causing oxidative stress and damage. So glutathione is actually a tripeptide. So because of this, it's pretty well known in the nutritional world that capsule glutathione doesn't get absorbed systemically. Why is that? It's because it's a peptide like these other things. So we don't have the necessary enzymes to break it down and properly absorb it. So that's where liposomal glutathione is very common. That's our flagship product and our top sold product.
I take it as a spray.
You do. So you're probably using ours then.
I'm not sure.
You're not sure? Well, maybe. Maybe not. But
I can change.
yeah. So it's our flagship product, but it's a cool trial because, again, glutathione is a tripeptide. So it's showing that we're able to get these peptides absorbed systemically. So this trial here, we had half the patients getting 600 milligrams of IV administered glutathione. The other half got 600 milligrams of our liposomal form. And then we did a blood draw 6 hours later. And on the far right, you can see the percent increase in blood glutathione levels after those 6 hours. IV at the top, our liposomal form at the bottom. Very similar increases across the board, with the slight edge actually being in our liposomal group, which smaller study group. So what this really shows is we're able to get comparable increases to IV administered glutathione or nutrients in general to IV administered glutathione, which again, Very impressive because glutathione via capsule doesn't get absorbed systemically because we don't have the necessary enzymes to break it down and properly absorb it. So getting in then to some of our Quicksilver liposome products here. So liposomal BPC 157, again, body protection compound. So it's the universal healing peptide. It's going to help with gut healing, lowering inflammation, really any healing that you really need systemically. And again, since it's our liposomal delivery, our nano liposomal delivery, you're going to get systemic healing of that peptide wherever you are looking to use it for. So some dosing recommendations for BPC. We are recommending to cycle these peptides. So if you're going to take them long term, we recommend to do 3 months on, 2 months off. Depending on what you're using it for, if you're just using it for general, healing support, general anti-inflammatory support, 2 pumps a day would be our standard dose. But for more severe cases, we do have a loading dose phase if you so choose. If you're looking to use these, and particularly the loading dose, I would just chat with Dan and Monica. They'd be able to answer the questions, get you the proper dosing for what you're looking to use it for. And again, long-term use, 2 pumps a day, 3 months on, 2 months off. So BPC with TB500. What do we use TB500 for? What do you think of when you hear TB500?
Tissue.
Tissue. That's what I like to hear. So BPC with TB5. This one is primarily utilized for joint healing and repair, for tissue healing and rejuvenation. So this could be for an injury. Maybe you sprained an ankle. Could be tendons, ligaments, bone healing as well. So it's most commonly used post-surgery, whether it's a knee, a shoulder, an ankle, anything that requires healing. An injury that's affecting those same ligaments, tendons, tissue. It can be used for muscle building as well. So if you're looking for a peptide to help with muscle growth, if you're looking to build muscle and you're having issues building it, the TB5 and BPC can help with that as well. It also might be an absorption issue, which at the end of the day, the BPC is also helping heal. So you're getting dual benefit with that. But again, also helping with blood flow. So, from what we were talking about before, would be good for that as well. While it's really just healing these various different things here. So I could read through all this, but I'm pretty sure I touched on it already. So dosing, again, 2 pumps a day would be our standard dose. If it's post-surgery, we're looking to do a loading dose for the first week, back down for the next 3, and then start doing our 2 pump per day dose. And again, if you're using it long term, we're looking 3 months on, 2 months off. One thing I should mention.
Here you have the 2 of them. You have the 157 and the TP.
Yep, it's got both of them in there. They work very nice in tandem together. Yep. And one other thing I was going to touch on with this. It slipped my mind, but I'm sure it'll come back to me. No, you are completely fine. It wasn't anything important anyway. But any questions on this one? Okay. Yeah.
Neuropathy.
Dan, neuropathy. Yeah.
That's a good question.
That'd be great for.
That'd be good for that. Okay.
Yeah. For the blood flow and the nitric oxide as well as the vascular healing.
We've been getting a lot of questions
Yeah.
on that in the pharmacy, and I'm like,
I would definitely lean on that. Oh, I remember what I was going to say now. Typically, these are shorter term use peptides too. More times than not, you're using them for a short duration to really improve wherever you're at, accelerate the healing process. And then once you get to a certain point and you're healthy, your gut's feeling better, whatever it may be, then you can usually dial back off of them and just maintain with other supplements, a healthy diet, etc., which, again, Dan and Monica have all those different things here that you guys can use from a maintenance standpoint as well. But this is going to make a very strong and quick, impact to getting you healing or moving in the right direction, and then eventually you can maintenance with other things as well. So typically this isn't something that you're doing, very, very long term. Same thing with that. So then the BPC with KPV. What do we think of when we hear KPV? Chronic? That's what we think. So chronic, so BBC KPV, we're using this one, gut healing. So IBS, IBD, Crohn's, anything gut healing, BPC with KPV, because KPV is helping with the gut barrier healing. It's helping blood barrier healing. Anything barrier related, the KPV is helping heal. It also is really dampening down inflammation or dampening down NF-kappa B. So if you have any toxicities, any mold, any Lyme, any metals, any parasites, your body needs to remove these, which we use the term detox in this industry. But at the end of the day, anything you need to remove that doesn't need to be in your body is a detox thing that's causing inflammation. Or if you have inflammation, your body can't detox as effectively With the KPV, it will dampen down the inflammation so you can effectively